Sweet. Okay. Welcome back to Coffee Talk.
Hello. Welcome.
I'm Dr. Angie, owner and operator of Synergy Chiropractic and Sports Rehab.
I'm Dr. Maryhelen Gustafson, owner of Nurturing Wellness Physical Therapy, where I specialize in pelvic health and orthopedics. And here we are. Again, to talk about pelvic health, women's health, movement, menopause, kind of the whole, though, menstruation through on the other end of menopause too.
Yep. And it's Monday morning from a long beach type of weekend. So we're lagging a little bit.
Yeah. We have treat drinks today.
I have my matcha latte.
And mine's, I don't know, some huge sugary Starbucks drink that's really good. And I'm not supposed to drink these
We're
things.
allowed to. Everyone's allowed to have their treats. Just don't do it every day.
And then
balance.
Water.
And then we have water.
With electrolytes.
Mine's in the booty. Mine doesn't have electrolytes yet.
I shouldn't be crossing my legs, but like I tell all of you guys, I do.
I'm going to cross.
Okay.
This way.
And
more comfortable.
You've watched Talladega Nights. I always feel like I don't know what to do with my hands. Did you ever watch that movie?
Yeah, but I forgot what part it is.
When he's being interviewed, Ricky Bobby doesn't know what to do with his hands, and so they have to push them down.
Wait, I think I remember
That's how
that.
I feel.
I love that movie.
I have to sit on them.
I just talk with my hands. So, okay. So today we're going to talk about Maryhelen's experience, pelvic floor, when it all, and we've mentioned it briefly in previous episodes. So I think we wanted to dedicate one episode of each of our stories and how we can lead up, and we just kind of have some takeaways. And if you find yourself in this story, because a lot of women have similar experiences, definitely maybe the time to take some action too.
Yeah.
So
all right. Yeah, I guess my first memory of any little, not red flags, but what do you call it? Like a yellow flag? Beige. Well, yeah.
I love beige.
With any pelvic floor whispers.
Yeah.
As we've talked about, I'm a distance runner. So in high school, I'm from Massachusetts. It was actually a race here in Rhode Island. I was finishing cross country. So this particular course, you're in the woods, like most cross country, but you finish on the track. And I vividly remember coming out of the woods, setting foot on the track, which is probably part of it, different surface. You're sprinting as hard as you can. And I started peeing, and I was, I don't know, 15, 16. So first I had no idea. I think I actually went backwards because I didn't know what that was, what this feeling was.
Yeah.
Yeah. And then I just remember finishing and sprinting to we used to travel to shower. So I had clothes and could shower in their locker rooms, but I didn't tell anyone, maybe my friend, but I had no idea why, or I just kind of panicked about it, but kept it to myself. And then it's probably the same season or around that time that I had a lot of hip issues in track.
Yeah.
So I think I missed, thinking about it now, that season, probably that was fall that the leaking happened. That spring I had a hip issue.
Okay.
That leveled me, so I wasn't able to compete that spring. So this is about sophomore year of high school. So if you think about two teen athletes, so on the back end of had started menstruation, but your body's changing too.
Absolutely.
And still developing, probably had gone through my last growth spurt around then. So that's a factor. And I went to a chiropractor that my coach recommended, and that helped. But never putting the pieces together of pelvic floor or women's health.
Yeah.
And that as a female, I should have been routed into some more women's health specific rehab, not just IT band, which is what I was getting.
Yeah.
And the IT band was a symptom of probably something more going on.
Think about how they have pelvic floor therapy. How many years ago was that then?
So it existed. I don't know
so
who the patients were then, though. If it was strictly post-oncology surgery or severe trauma during birth that required surgery, I don't think rehab professionals were addressing this.
Yeah, that's crazy.
And I don't know when this part of pelvic health started to open up.
Yeah.
I don't really know. because I had to find it myself
Yeah.
in 2014.
Yeah.
So this was, we're talking 1996, maybe 1995.
Okay. So then so you had leaking. This was high school.
High school, yep. And then
How was
college, I
college?
competed, but I was chronically injured. And
Really?
so it became unfun. I wasn't very good. My times, some of them were worse than high school. So I just made the decision to quit after I ran cross country in the fall as a freshman. I got injured during indoor winter, missed outdoor spring, and then came back after training through the summer with my high school coach and had a pretty good sophomore year cross country. But again, I was struggling with some hip, glute, all the things you've treated me for.
Yeah.
So I just quit. It was a hard decision. It was not easy. Running was my life, my identity. Pelvic floor wise, I don't remember having too many issues, but I think if this were now and you were telling me, if you're coming in at the ages I was with these chronic hip, leg issues, no doubt I would say you have to, maybe pelvic health isn't the only provider you should see, but a big part.
Yeah, absolutely.
And then let's see, went on to keep running just recreationally. Had my first pregnancy and delivery in 2012. Had no pelvic rehab for that. I didn't know we existed.
Yeah, I know. We talked about that. You still they're like, I don't know. This is just
I had a
what
doula, which was wonderful. I had a great experience at South County Hospital. I watched movies about birth. I tried to educate myself, but I was not in the space like I am now. I didn't go to any birth classes other than the hospital. I had a grade 2 tear, which they kind of always blow off. They just say, no problem. Had the typical, I ran through my pregnancy up until maybe 25, 26 weeks, nothing crazy, like 3 miles. I stopped when it felt awkward. And then my postpartum experience was eye-opening. And that was again, another whisper into there has to be more out there.
Can you go into detail about what that postpartum was?
So I had the grade 2 tear. I had a baby with very severe reflux that we ultimately had to medicate. So with that, lots of soothing, not a lot of sleep. I went back to work at 10 weeks, not full time. I didn't have any more. I had the state, I forget what they call it, temporary TDI. Yeah. And so you get partial pay for 6 weeks.
Gotcha.
And then I used vacation weeks of no pay. So that was paid. And then I did a week or 2 of no pay.
And you're like, I got to go back.
And then I went back to work. And so I was, setting my alarms to pump at night. I was not sleeping. Yeah. So that wasn't good. And then I had a really tough baby. He just had trouble with his reflux and digestion. So sleep was not great. And before going back to work, I had that 6-week check. So I was cleared for all the things. My incisions were healed. And go back to sex, go back to running, good to go, see you next year type of thing. Yeah. And so at 7 weeks, I went back to running. And this is my story where I tell my patients I wore gray leggings because I did not know it. I put on the ones that probably sucked my stomach in the most is why I wore them. Ran a bit on the beach, peed my pants like crazy, and was so embarrassed. And then, resumed intimacy, and that felt terrible because what no one told me is when you're nursing full time, like I was, your estrogen dips very low, like in menopause. So that makes the vaginal tissues very dry. It felt like sandpaper. I thought there was something wrong with me because I was cleared. So what's wrong?
That lack of education.
My incisions were healed, so there's something wrong with me.
Yeah.
And then I had a diastasis that I didn't know about because I hadn't been trained in diastasis education for myself. No one checked me for it. It wasn't until I was pregnant with my second was early pregnant in 2013. I gave birth to him in 2014. A colleague checked me. She did not know I was pregnant, and she was just talking to me about diastasis because she went to the URI PT program where they came out learning about these things, which is great.
Yeah.
And I had one, but then I was like, well, I'm not going to do anything about it, right? Because I'm pregnant, which was not correct. Mm-hmm. So then after my second was born, I had another grade 2 tear. I had not gone to pelvic PT during that pregnancy. I, again, did not know. And I had a much bigger diastasis that the midwife said, you know, you're a PT, you know what to do.
Yeah.
If it doesn't feel good, you can just have surgery when you're done having babies. That was my education on that.
So can I ask you a question real quick?
Yes.
If you had gone to pelvic floor therapy during pregnancy, can you prevent those tears from happening?
I try not to be so black and white.
Yeah.
Pelvic health therapy, specifically being trained in perineum massage and better breath techniques, definitely can reduce the likelihood of a grade 3 or 4 tear or the use of a vacuum or forceps. We do have research to show that.
Yeah.
The level of tearing I had, which doesn't get into the anal sphincter, luckily.
Yeah.
But I can't say for certain if I would have prevented that.
But you could have.
But knowing what I know and what I do with my clients, and what I did ultimately see a pelvic PT in Narragansett, she's amazing. When I was pregnant with my third, I had a much better birth experience with my third. It was one of those, like, we pulled in and I barely made it out of the elevator. And I think learning what pelvic PT can help with, if you're with someone that specializes in pregnancy and labor and delivery, we're balancing your hips much like you do.
Yeah.
Creating space so baby's in a better position, because my second baby was transverse and I knew that, but I was only given the idea of being on all fours. My midwife just said, get on all fours. So I did, and that is helpful, but there's so much more. I needed someone internally assessing my pelvic floor and creating space so that he had space.
Yeah, absolutely.
And I needed someone addressing my SI joint to create more evenness there so that he had all the room so he wasn't transverse.
Yeah.
So big regret not looking into
But you
PT.
don't know what you don't know.
Yes.
Right?
And that's what's driven me. So it was after his birth where I had this body that I just was like, I feel like I can't run. My back's always going to hurt. I'm going to blow open my core. That's what it feels like.
Does that sound like anyone that's listening to this? Seriously.
Yeah. And then, I also had prolapse symptoms after my first.
Yeah.
And I was told I don't have to have sex again if I don't want to, from a female OB. That was after my first baby. So sleep deprived.
God bless.
I went back in at 8 weeks postpartum because I was like, things aren't right. You said this and I'm doing this. And she just kind of said that.
Yeah.
It's like, okay. I mean,
I know.
You don't have the power, like the brain power or the strength. And I didn't have the education to ask questions and to follow up.
You've been through a lot. I don't even think you've told me the extent of all this.
Yeah. It was the work combo of going, I definitely had a lot of examples of postpartum anxiety. I have anxiety anyway. I was diagnosed in college. It's ebbed and flowed through life, and I have done well with running and exercise to help with the symptoms of it. And that's part of why I'm a PT. But with pregnancy now, we know any change in our hormones, when you're walking into a pregnancy with a history of any depression or anxiety, we should be monitored much more closely. They call you on the phone, like the nurses station will call you a couple weeks postpartum and say, like, are you all right? And you're like, yeah, I mean, but it's literally, you feel like a dumpster fire, like those memes you see of your house on fire. Yeah. Because you don't even have the words to explain how you feel. So I should pipe in, if you are listening, that in Rhode Island, women and infants and maybe I can give you we can put it in the Instagram when we post this. They have an amazing day program for postpartum moms if you are feeling like you need help. So it's for mental health therapy. You can bring your baby so you're not separated, because that's a huge part of it, of not seeking help. And same for coming in here. I always say bring your kids if that stops you. And I've seen Angela's made the waiting room like a craft station. You've had, yeah. We want moms to get help that they need.
Yeah, absolutely.
Yeah. So after my second, it was honestly a bit of a aesthetic reason. I was very annoyed, and it still bothers me, my abdominal wall, just how big of a change it went through. And I was trying all these different apps that were targeting me to deal with it, and nothing changed. It wasn't until I went to a bunch of courses, as trying to be certified in pelvic health and getting all the education to treat everybody, that then I was sometimes the patient example in these classes, and got to receive a lot of great ways to treat myself from all these professionals around the country.
Isn't it crazy how like it's like our journey and our story can put us in that direction of like what we're doing and how we want to help people.
Yes.
But like, yeah, you've been through a lot, and having multiple kids.
Yes.
Like it can pile on.
It totally piles on.
And that's what, and like I think I noticed with a lot of women, they're just like, I feel this, I'm just gonna wait till after.
Yes.
Like I'm done having kids. Like what would be your messaging though to those moms that are just like, I'm just gonna wait till I have kids, and then time sometimes goes on. Before you know it, your youngest is already 5 years old.
I know.
And you've been dealing with this pain for 5 years. So like, what messaging can you say to those moms?
That anytime you can carve out to come see someone like us while you're pregnant or when you're in it, it will shorten the amount of time in your life that you're being affected by these symptoms.
Absolutely.
And it's just like anything. It's like if you have your Aunt Phyllis who has had back pain as long as you've been aware, right?
Yeah.
The longer she goes without getting it treated, it's going to make her rehab longer. Like addressing things as soon as we can. And then my thing, I've said this a lot, I wish PTs were called preventative therapists instead of physical therapists, because so much of what I do is talking in advance before things happen, so that you see the whispers, you see the signs, we pick them up right away and set you up and just give you like the best base. Especially if you're a mom, we can't give any more of ourselves. Like we have to fill up more. And that's only like the trickle down effect, especially if we're talking about mental health, is huge. Like I felt my entire identity, especially after my second, I stayed home from work because of multiple reasons, but the business I was working for was being bought. My husband's business situation was changing in terms of hours he had to be at work. So we would have been paying for like before care and after care pickup, because I was working long hours till like 8 or 9. Or at least till 8, so not getting home till 9. What am I saying here? So I stayed home after my second. So I lost my identity of running, my professional identity. It can very much feel like the walls are closing in. So if I had taken better care of myself and brought my babies with me to an appointment, I think that really would have given me more of a boost. And I also always wonder how it affects subsequent, like I had a much harder time getting pregnant for my third. I had some early chemical pregnancies, which are a form of miscarriages. And then I had a very real miscarriage that rocked my world quite a bit at 9 weeks it was around the holidays. And I just always wonder how, we don't know, my messaging I got again from my healthcare team was that it was my age. I was 34. So I don't buy that either 100%. Certainly it contributes, but I think the amount of time it took me to get pregnant is curious. I'm curious about that. And I think if I had more of a care team and if I had asked for help, which I'm not very good at doing, things might have been a little different.
I think that phrase I like to say is that you have to create a safe space in your body.
100%.
And I say like, even if like when we're trying to get pregnant or unsuccessful, for a while, whatever, whether you do IVF yet or not. I say like, okay, like in a lot of them, if I do see them have chronic pain, that's inconvenient.
I know. We can hear the lawn people. Maybe you can't.
I say, like, have you created a safe space in your body? Have you done everything you can to take away your chronic pain? Have you, like, it's just the matter of just like really honing in and getting that inner peace and that, like, just taking away factors that cause that stress in your body, right?
100%, because babies need a safe, nurturing environment.
Exactly.
Yes, there's examples in history where babies have been born during war. It happens.
Yeah, it's always going to happen. You're always, and I think women are always just like, well, how come this happened to this person, or it happened before for me? Like, why isn't it doing it now? But like, remember, everyone's body is so different.
Yeah.
And just like what your body needs is like, unfortunately, we can't just like plug us in and be like, all right, can you give us a body check? Like, what's wrong? What do we need to change?
Yes.
And so that's why, it's like we have one body. We have to do everything we can and tell moms, like, don't wait. Like, you don't feel right after pregnancy, before, pelvic, whatever it may be, like menopause, whatever age, like, please go get checked.
Yes.
Like, please go take care of your body, because, like, we have one.
Yeah.
Why do you want to live so uncomfortably and so almost like mental toll that it has on you too?
Yes.
You can really like prevent all that and not get to the point where your day is affected.
Yep, I agree.
So thank you for sharing your story.
Yeah, I think that's like, I think those are all the tidbits. I did delay seeing pelvic health myself after my third, which was really dumb. Because at that point, I was a pelvic health therapist, so I knew better.
Oh, baby, we're fine.
Well, and just like, I knew better. I should have gone. So I've gone to my own now. And she's also wonderful. And so I use her home program a bit. And then I've seen Angela for my hip. It's the same hip stuff that I had as a teenager. And usually the best way to address it is strength training, which no one on my story as an athlete and being a college athlete, we did have a training day, a strength training day, but it was nothing like what it should have been. No. Now that everything I know.
You gotta change the biomechanics, and from there build strength.
Yep.
Hone our movements. Need to be strong.
Yes. Thanks for listening.
That was great. That was awesome. Seriously.
Yeah.
That was really awesome. Thanks. See you later.
Bye.